This segment of DelmarvaLife is sponsored by TidalHealth.
As we age, there are certain precautions we need to take to ensure we can remain healthy and functional into our later years. For men, an enlarged prostate is a common medical issue, and in order to seek relief from its side effects, there's a cutting-edge treatment option that urologists in the area are very optimistic about. I'm happy to introduce Dr. Elizabeth Kornfield Chadwell and Dr. David Cohen, both with TidalHealth Urology. Welcome to DelmarvaLife.
Thank you.
So let's start there. What is aquablation therapy and what does it treat?
Well, aquablation is a procedure that uses new technology to remove tissue from the prostate in order to help men urinate better with a better stream. If you're suffering from getting up at night or urgency or struggling to urinate, we remove the tissue, and this technology allows us to do that much more effectively.
Can you describe the procedure and how it works?
Sure. I have a small model here that might visualize a little bit better. The prostate grows as men age. There's very little you could do to stop that. And as it grows, it blocks the channel for the outlet of urine. And what we do is we put a telescope in, and this new technology allows us to cut this tissue out using a water jet, and similar to a water pick, and at high pressure takes the tissue out using technology to control for the pressure and the depth to prevent any major side effects.
So it's a different kind of procedure than usual. How is it different from those other treatments for benign prostatic hyperplasia or BPH?
So for a long time, the main procedures for this, or the kind of the biggest operation that's done, is a transurethral resection of the prostate, which uses cautery, which uses energy to basically remove tissue around the urethra. Because as we were talking about, the problem is that as the prostate grows, it sort of squashes the urethra and makes it harder to pee. So the traditional procedure that's been around for a very long time is to remove all that tissue. So there are some newer iterations of that, but all of those procedures that remove tissue involve using some kind of energy that has transmission through the tissue. What's different about the aquablation is that since it's just the water jet, a high pressure water jet, it doesn't have that kind of thermal energy. So there's less potential for there to be damage outside of the tissue that you're actually removing. The other thing that's different about this versus all of the other technologies that have existed up to this point is that it's customizable for the individual patient. So this is used also with ultrasound control. So you can see the entire prostate and you create a plan that shows exactly the tissue that you are treating, so that you're removing a very specific area of tissue. And the other thing that's different about this is that it protects the area where the ejaculatory ducts come into the prostate. So one of the big problems with these procedures over time has been basically impact on ejaculation. So with this, with aquablation, we can spare the area where those areas are within the prostate. So the potential for having problems with dry ejaculation or retrograde ejaculation is basically very, very, very low, as opposed to that happening pretty commonly with any of the other procedures that are done.
It's amazing. I mean, you can get real specific where you're applying it.
Exactly.
How does someone know if they are, if they're able to be a candidate for the procedure?
So there are a lot of different tests that we do in the office that we'll kind of talk about. So a lot of this has to do with the size of the prostate, the shape of the prostate, and what the urine flow is like. So most commonly, what we would do is do some sort of evaluation of the overall size of the prostate. It can be done a couple different ways. Take a look in the urethra of the telescope to get a sense of kind of the anatomy, internal anatomy of the prostate. And then do another urine test, generally called a uroflow, which is just to check how rapidly urine comes out, kind of when you pee, and then also check how well somebody is emptying their bladder, whether you leave a lot behind when you pee or not.
So basically, if you're getting up at night multiple times, if you're struggling to urinate, if you have to run to get to the bathroom, if sometimes you don't make it, those are all symptoms that tell you that your prostate's probably getting bigger. It may not be from the prostate, so we have to make sure that it's the right diagnosis. And those are all the symptoms that go along with men aging.
So if folks are interested in finding out more, obviously they can talk to their urologist or their doctor and go from there.
Correct.
Yes.
Wonderful. Dr. Elizabeth Kornfield Chadwell and Dr. David Cohen, thank you so much for joining us this afternoon.
Pleasure.
Thank you for having us.